I am Dr. Kannappa, Assistant Professor in the School of Social Work, Indira Gandhi National Open University, that is IGNOU, New Delhi. Today I am going to talk on a particular skill that is called psychosocial assessment, and this is very much important for medical psychiatric social workers, and especially the psychiatric social work trainees or psychiatric social work professionals, those who are working with the patients and caregivers in the hospital setting. The psychosocial assessment is a base for any kind of psychological or psychosocial intervention for psychiatric patients or their caregivers. So based on this psychosocial assessment, we are going to give impression saying that whether the psychosocial status of the patient or caregivers or even the family is adequate or not adequate, and then we are going to set our interventions. So there are a number of factors under psychosocial assessment. So when you are working with the family members and the patient in the hospital setting, as part of your field work or as part of your concurrent blood basement work or as part of your work employment, you will have to consider this thing as the basic assessment. So in a therapeutic setting in the hospital or even rehabilitation center or drug addiction center or even community mental setting, so you will have to sit with the patient. That is one assessment. Another assessment is you will have to sit with family members. So combined together you can make a final assessment. So when you sit with the patient and family members, you will have to assess psychosocial components. The first one is important socio-demographic variables are the factors. So you will have to take the patient name, the age, gender, education, marital status, and his occupational status, and his any other health related history, medical history, psychological history, all those things. Same thing you will have to do it with family members. So what is their relationship with the patient? What is their age? What is their occupation? What is their income? What is their other resources? Whether they have a good family setup or whether they have any other setup in the community. All those things you will have to assess. That is the first thing. Second one, you will have to go for genogram, family genogram. That is a family structure. So we know that in the family, in the Indian setting, there will be nuclear family, there will be nano-nuclear family, there will be extension family, there will be joint family. So whatever is there for the patient and the family members, you will have to draw that genogram. So there the patient is an indexed person. So what is whether the patient is the son, so he will have obviously will have a father, mother, sister, brother. All of them you can draw in the picture, and you can show what is their relationship. You can show their age. You can mention their education background. You can also mention their occupation in the genogram itself. So that will give a complete picture of the family structure that is related to the patient. Once you draw that the family structure, then you will have to assess their communication. So communication is another very important factor under psychosocial assessment. So communication generally you can mention there itself. Communication, the patient communication with the mother, the patient communication with the father, the patient communication with the siblings. For example, the patient is unmarried, you can write like that. Otherwise, the patient is husband, you can write that patient communication with wife, the patient communication with father, the patient communication with the mother, the patient communication with other family members. So it depends on the family structure genogram. You will have to write that communication. Generally, in communication, you will have different types. First type is switchboard communication. You will understand what is a switchboard communication means. There will not be direct communication between the indexed person, that is nothing but the patient, and other family members. For example, patient, if there are some issues with issues between the couple, generally there will not be many times they will not have a switchboard. They will have a switchboard communication. Rather, they will have sometimes if they want to say anything, they will not say directly. They will say through child, or they will say through some other family member. So that is called switchboard communication. Sometimes they will have a kind of indirect communication. So we will have to mention there whether there is a direct communication between the people or indirect communication. So that is one. And we can also mention that whether there is a good verbal communication or a emotional communication or any non-verbal communication. So all of them are very much indicators for our diagnosis or a kind of impression. So once you understand the communication pattern in the family or between the indexed person and the family members, then you can go for another factor that is called family income. So family income also plays a big role in terms of our psychosocial management when you are helping the patient and the family members. So you can assess what is the income of the person for month wise or annual wise or other family members. So that you will have to mention. And then other resources. Some people will have a land, some people will have properties, they will have different kind of resources in the community or in their village setup. All those things you can assess from the patient side and the family member side, and you can put it under resources heading. The next factor under psychosocial assessment is the illness, the mental illness history in the family, or psychological illness in the family, or the history of substance abuse in the family. That is very much important. So whoever is there in the family, you can assess whether is there any medical illness in the family. It could be cancer, it could be hypertension, it could be diabetes, or it could be any other chronic illness, or even non-communicable illness also. You can mention that, because if there is a medical illness in the family, history of medical illness in the family, the burden is too much. Same thing, you can also write the history of psychological illness or mental health illness in the family. Somebody will be having alcohol addiction. Somebody in the family will be having the nicotine addiction. Somebody in the family will be having many other psychological issues like schizophrenia, depression, bipolar affective disorder. So if there is a such kind of history in the family, the burden will be too high on the family. So that you will have to assess. Another important factor under psychosocial assessment is cohesiveness. Cohesiveness is nothing but we feeling. So when social worker or social work trainee, when you are practicing social work methods in the hospital setting, when you are working with the patient and family members, you will have to understand when you are drawing genogram, family genogram. So there will be a number of people. There will be 3 people. There will be 4 people. Sometimes there will be 5 people if it is part of extensional family or even the joint family. So you will have to see whether there is a connectedness feeling among all family members. So when one person is affected, definitely other people in the family, irrespective of the relationship, they will also feel that we are all part of the family. We should help each other. So we have to understand their emotions. We have to understand his difficulties. We have to help him in difficult circumstances. So you will have to see whether there is a kind of we feeling in the family. That's a part of cohesiveness. So once you understand that, you can mention that whether it is there or not. So if it is there, you can write that it is present. If it's not there, you can write that as absent. So another very important factor you will have to assess as part of this thing is coping mechanisms. So when there is a illness in the family or when there is an issue in the family, so what is the coping mechanism of the person and the family? So some people, when there is a depression, when there is a schizophrenia, when there is a suicide ideas, and there is a kind of financial related issues, many people may get into negative coping mechanisms. They take alcohol, they take nicotine, they take marijuana addiction, they take different kind of other coping mechanisms. Similarly, we will have to find out the positive coping mechanisms. So if there is an issue in the family, how the family members are going to adapt the situation, how they are going to use the particular situation, how they are going to cope up with the particular situation, the positive coping mechanism, discussing with the family members, discussing with the elders, getting support from neighbors, going to hospital-based professionals. So there are a number of positive coping mechanisms. Visiting mandirs, doing some kind of puja. All of them are part of coping mechanisms. So you will have to assess that. And another very important factor as part of psychosocial assessment, that is a problem-solving technique. So problem-solving technique, we know that Ellen R. Coleman has given the problem-solving technique. So the same technique you can assess as part of psychosocial assessment. Here, whether if there is any problem in the family, all the family members coming together, discussing the problem and finding the various causes for problems and finding various solutions for the problem and identifying the ultimate solution for the problem. So whether our family members going to utilize this problem solving technique in the family or not. So this you can assess with the patient as well as the family members. Finally you can go for conclusion saying that yes, they use some kind of problem solving technique when there is a problem. Sometimes they may not use directly, they get into various other discussions and they may not find a solution also. So all those things you can utilize. So any other components as part of psychosocial assessment also you can use. For example, sometimes family rituals. This is very important component under psychosocial assessment. Family rituals. If there are 3 family members in the family, husband, wife, and child. If there are 4 family members, 2 children, couple. There are 5 or 6 family members, like for in-laws, couple, and children. So all these family members, irrespective of the size of the family, whether they are performing certain family rituals or not, that you will have to assess. What are the rituals, family rituals? That is very important component you need to understand. Eating together in the morning, eating together in the afternoon, eating together in the evening. So this is one of the component of family ritual. That is one thing. Second one, and going out together. It could be picnic, I could be visiting Monday, I could be going for shopping. That is another family ritual. Third one is once in a while they may also visit the social gatherings like the marriage ceremony or any other get-togethers. This is also a family ritual. Whether all family members together they are visiting or not. So this is another very important component is celebrating a festival. All family members, for example, it could be Deepavali, or it could be Sankranti, or it could be Navaratri. Whether all family members coming together and participating in the particular ritual or celebrating or not. So these are all family rituals. Whether the particular family part of the patient performing or not, that you will have to assess. So these are all very important psychosocial factors. If you assess with the patient family members, finally if you can combine together, you will understand whether the family is following having adequate social support or not. The family is having adequate psychosocial status or not. So another important thing I have forgotten, I am going to mention now, that is social support. So we have 3 components under social support. That is the primary component. If there is adequate social support, you are not going to adequate social support. I mean, you are not going to provide. If there is inadequate, you are going to provide. If there is a inadequate problem solving technique in the family, you are going to focus on that. If there is a inadequate co-serious in the family, you are going to focus on that. If there is a mental illness, psychological illness in the family, that causes a lot of burden, you are going to address like that. So like that, there are various other factors you are going to cover, and based on that you are going to provide your interventions. So all the medical psychiatric social work, the trainees are professionals. When you are working with the patient and family members in the hospital setting, we are going to use that. And especially from IGNO, when I am teaching the Bachelor of Social Work online program with many other country students, we are going to put them in hospital setting, NGO setting, even rehabilitation setting, and our students they are performing this assessment, and based on assessment they are going to make certain target interventions like problem solving technique, enhancing social support, enhancing well-being of particular person, or teaching them some kind of yoga, or teaching them stress management. So they are targeting, and that target intervention they are providing. So from the since this is an online program from IGNO, so from here itself through different online methods, we are teaching our students and they are practicing wherever they are there. For example, I have students from African country, I have students from Brazil, I have students from Nepal, Bangladesh. So from here itself through different digital platform we are teaching and they are practicing.